I sat down with Dr. Andrew England, who is a senior lecturer in medical imaging at University College Cork, and I asked him how he and his team use DetectedX with their students. Here's what he had to say. Okay, so Andrew, how do you and your team use DetectedX?
Yeah, no, thank you for the question. So we're delighted to be using DetectedX, and we use it across the three programs that we currently teach. Two are pre-registration courses, one in diagnostic radiography and one in radiation therapy, but we also use it in our postgraduate taught modules, which are fully online, and that's one of the features of DetectedX that we love. It's fully online, it's in the cloud, so there's no downloads, there's no software purchases for students, and we give it to all of our students and staff. It's part of our educational provision.
And so you said all of your students use it. Does that mean every year group, or is it usually first or second years across the
No, absolutely every year group. So I guess when you're enrolling in some university courses, you may get access to a virtual learning environment. We use Canvas at University College Cork. At the same time, we give all students, access to DetectedX, and we're particularly delighted now we have a single sign-on, so students don't have to remember what's my password for DetectedX when they're on the university system. Whatever email address and whatever password they use for to log on, that just takes them straight into DetectedX. So it's seamless.
Would you say that's the biggest benefit, or if you had to give a few points on what are the benefits of using DetectedX with your students, what would they be?
So it's I guess it's an access to a repository of images. I guess radiation therapy, diagnostic radiography, it's about images, whether they're oncology, trauma, chronic diseases. And I guess when you think about a virtual learning environment, that's often a store maybe PowerPoints or recorded lectures or links to literature, but we often struggle with access to clinical images and in a way that they would see them within the clinical department, so the ability to window, magnify and zoom. So DetectedX gives all our students that, but it gives it more in a way that it's structured. So there could be, a section on, say, chest disease, and you could send a student directly to that and they could look at some chest x-rays, some CT scans, but it's structured. At the same time, you can just give them a task to maybe, refresh their anatomy of the abdomen by essentially scrolling through some abdominal CT images. So I particularly like the fact that it's a rich repository, but it's also structured in modules, whether that's by imaging modality, by anatomy. And there's not just images, there's videos on there. So we particularly like the physics videos. So if you've got students, say they're struggling a little bit, with X-ray production, they've had some lectures, they may have had a tutorial, but then there's the DetectedX resources as well. They can go away and watch a video. Some of the videos will have maybe a quiz associated at the end. So it's more than just, a repository of images. It's almost a repository of images and educational resources.
Given what you know about it and have used from it, would you recommend it to a university or institution that isn't yet using DetectedX?
Yeah, no, absolutely. We were kind of, I guess we knew of DetectedX from our links with the University of Sydney, and it's something we never look back on. As I said, we use it more and more now, like having a virtual learning environment, as a repository for PowerPoints, recordings, using for assessments. We would fully recommend using DetectedX as the partner really for the, the image archive, the radiology archives. I guess if anyone asks us kind of what sort of educational technologies we use, DetectedX is right at the forefront there. It's it's written by radiography educators, so I guess they know the challenges we have. We're not trying to find a platform that kind of works. It's been written by guys at the University of Sydney that have an amazing radiography course, so it's kind of like fit for purpose.
And last question, you yourself, what is your personal favorite module or feature of the platform?
Well, the feature for me, and it's something that I've not really touched upon, is the way we can use it for research. There's a creator option within DetectedX where essentially you can upload some images, you can create some questions, and you can either use that, I guess, like a quiz in terms of students maybe getting some feedback on, image interpretation. But at the same time, we use it maybe where we're getting students to score some images that have been acquired using different exposure factors. So we do a lot of dose optimization research, and we've started using DetectedX really as our platform for collecting research data, which again, there isn't really one in the past that we felt is totally fit for purpose. There are things out there that you can use, but it's online, it's in the cloud, so we have no problems go into sites with discs, and they've not got a CD reader, or you can't put a USB stick in the computers for obviously data protection. So we've used that really successfully for research. So I would say, obviously, primarily we use it for teaching, but that's not its only option. We use it for collecting research data. And again, we're hoping to extend the ability to do that as the platform grows.
Fantastic. Excellent. Thank you so much for your time, Andrew. Appreciate it.
Yeah, no problem.